Hi everyone, it's Mari here, and today I'll be presenting a summary on desensitization to aversive stimuli. In particular, I'll be focusing on systematic desensitization, which is a behavioral treatment targeting specific fears or phobias. Systematic desensitization substitutes an undesired fear response for an appropriate behavior, typically muscle relaxation. An individual is gradually exposed to the target feared stimulus or environment while conditioning another response to it. So how does it work? Counter-conditioning occurs when the undesired avoidance response is placed on extinction. DRO procedures are also often used in combination with this. Finally, shaping takes place when the response class gradually is changed throughout the response hierarchy. The process of systematic desensitization is as follows. In phase 1, a fear eliciting hierarchy is constructed in collaboration with the individual. During phase 2, an alternative response is learned, most often progressive muscle relaxation. Phase 3 involves either imagining or contacting in vivo the fear-eliciting stimuli, and finally, phase 4 consists of the individual progressing through the fear-eliciting hierarchy until the terminal goal is reached. Here's what a simplified version of what a fear-eliciting hierarchy might look like for a person who is scared of cats. Step 1 would be imagining a picture of a cat, 2 would be watching videos, Step 3 would be sitting near a cat, and Step 4 would be petting a cat itself. Systematic desensitization has been empirically supported for a variety of target behaviors, populations, and ages. Here are some examples. Jones and Fryman used in vivo exposure and reinforcement to reduce a fear response to bugs in a neurotypical boy. Ost and colleagues used 1 and 5 session exposure conditions to treat adults with claustrophobia. Both durations of intervention were found to be effective using in vivo training. More recently, Mendel and colleagues used a virtual reality training with a DRO procedure to treat a blood draw phobia with an adult diagnosed with ASD. Post-intervention, increased compliance in generalization settings was also observed. There are a variety of sources which inform the use of this intervention. Psychological assessment measures in the case of specific diagnosed phobias may be used. Self-report or conversations with the client, as well as direct observation, are all appropriate methods. When developing the fear eliciting hierarchy, you want to consider the following. The goal is to create an individualized, sensitive hierarchy to shape behavior. It's recommended that you include 10 to 25 steps and organize the stimuli from least to most fear eliciting. In terms of data collection, the dependent variable most frequently cited is approach to phobic stimuli. During baseline conditions, the terminal stimuli or goal is presented. If any avoidance behavior is observed, trials are terminated immediately. It's important to note the appropriate conditions for the use of systematic desensitization. The first is that it's been demonstrated to be effective in treating specific phobias with easily identified target stimuli. In other words, phobias to specific, tangible objects or specific events. However, it's only appropriate after a very thorough assessment has been completed. The fear eliciting hierarchy must be highly individualized, otherwise intervention is not likely to be effective. This will allow for the stimuli to be organized from the least aversive to the most aversive. Finally, you must determine an appropriate exposure method. Empirical support has been demonstrated across all topographies, with the behavioral literature citing in vivo most frequently. This is likely due to the observable responses. Despite its empirical support, systematic desensitization is not appropriate in all conditions. When the fear responses are elicited in broad contexts, it may be difficult to create an exposure hierarchy. For example, if all weddings, parties, and concerts elicit a fear response. If access to the fear-eliciting stimulus can't be controlled, it may be challenging to effectively implement. For instance, if an individual considers medical procedures to be aversive, it might not be feasible to get access to the medical staff or environment frequently enough for trials. And when the fear-eliciting hierarchy has too few steps, the therapist runs the risk of exposing the learner to aversive stimuli too quickly. As you can see, many of the inappropriate conditions for implementing the procedure may be a result of insufficient planning. To summarize, systematic desensitization is a behavioral intervention which exposes individuals to progressively more aversive stimuli. It's been effective with a wide variety of populations and a range of fear-eliciting stimuli. Thanks everyone for listening to my presentation. Here are the references that I've included throughout for your review. The next slide will also contain a citation on the presentation template I used.